In the tutorial group, a tutor must guide the students in such a way that there is an efficient and effective learning process. The tutor guides the tutorial group regarding content and process. In the tutorial group, the students have to work at tasks in a systematic way. The 7-jump is a method for tackling the explanatory tasks. The 7-jump. 1. Clarify terms. 2. Define the problem. 3. Analyze the problem. Give possible explanations. 4. Summarize. 5. Formulate learning objectives. 6. Self-study based on step 5. 7. Report back in the group. Discuss. In the report phase, step 7 of the 7-jump, the tutorial group is especially valuable for students if they can deal with remaining questions about the subject matter, share their knowledge in their own words with others, evaluate whether they master the subject matter, apply their knowledge to explain the case, compare the relevance and depth of their study with that of other group members, get an overview of the subject matter and integrate knowledge in specific areas, add to each other's knowledge, signal gaps in their knowledge, have discussions about the subject matter, compare their knowledge with the results of other group members, signal misconceptions about the subject matter, and experience an array of perspectives. The task of the tutor is to guide the tutorial group in such a way that these goals are realized. In this videotape, several of these goals are illustrated in a tutorial group observed in the report phase. The case they are using is: a young woman, 16 years old, visits her family doctor with the following complaints. She feels feverish. Her ankles and wrists sometimes hurt and feel warm. A week ago, this pain started in her right knee. The right knee is much better now, but at present she suffers especially from a painful and swollen wrist. She feels tired. 4 weeks ago, she had the flu and a sore throat, and she still has not recovered. One of the students, sitting in the middle, is the discussion leader, and another student makes notes on the flip chart. The tutor is sitting on the extreme right. Several interventions by the tutor during the reporting phase, step 7 of the 7-jump, have been selected. The tape starts at the beginning of the report phase. Reporting focuses on one learning objective. These symptoms can be explained by juvenile arthritis. The selection is not an exhaustive illustration of all the tasks a tutor might have in this phase, but it gives an adequate impression of what a tutor should do.
Today our assignment was to do the following. Can anyone explain, our learning objective was, can the patient's symptoms be explained by the diagnosis of juvenile rheumatism? Can you all tell me what you've done?
Shall I start? Well, I used a textbook of rheumatology from Kelly, and the chapter of juvenile rheumatism.
Yes.
Maybe you can tell us.
No, just past literature first, or?
Yes, it's
Yeah,
all right.
Oh,
It's all right.
yes, I did it from the
The
same,
same
book.
book.
Yeah, I did the same thing, and a book by Mason about clinical rheumatology, which also had a chapter on juvenile rheumatism.
And I did more or less the same what you all have done.
Yeah, I did a little bit in book of internal medicine.
I did a chapter from Mason, Clinical Rheumatology, same as Johannes.
Can I get back to Rowan? Which book did you use? In
Autolander and Harrison's.
I see.
Yes. Okay. Can anyone explain if the symptoms are could have been explained by the juvenile rheumatism? In general, what have you all done? Can you explain what you've done?
Well, first, my biggest problem was that we started with this girl who had influenza. I had a flu before having her rheumatoid complaints. Yeah, but I couldn't find that anywhere. So this was kind of a big problem for me. Apart from one of this juvenile rheumatoid arthritis, they separated in three categories. A systemic onset, a polyarthritical onset, and an oligoarthritical onset. And the onset of the systemic disease, you could think, there's symptoms of slight fever, malaise. So if she had that, she might have thought she had a flu. But on the other hand, only rheumatoid fever, for example, there was mentioned a sore throat, an inflammation because of streptococcus infection. But further, the symptoms of rheumatoid fever were completely different from the symptoms she suffered. Yeah. Mm-hmm.
So what in effect you're saying is that the symptoms she had before might not have been a flu and just the onset of this disease that we're talking about. Or?
Probably, because really explicitly a flu as an introduction to rheumatoid, to juvenile rheumatism is I couldn't find it.
So, if I may for a second, your impression is that the flu has only been added as something distracting from the real case? So it's something extra which may have nothing to do with the symptoms that develop afterwards? Is that what you feel?
No. Actually, I was confused because, like I mentioned in our brainstorm already, that I heard about a flu being the onset for juvenile rheumatism, but looking up the literature, I couldn't find it stated.
Did anybody else find any clue?
What about other categories? Could they have explained, the onset of the flu, for instance? You were talking about the systemic onset.
Yeah.
What about other categories?
Well, in the other categories, the complaints start with pain in your joints, and not with what this girl is having, named the flu and a sore throat. But I'm sharing her ideas.
That's what I wanted to.
Systemic onset is like spiking high fever, and this is just a bit of a flu. So it's two different things, if you ask me.
Yes.
In the categories you mentioned are those categories of juvenile arthritis? Is that right? Yes.
Yeah.
Is there any description which is alike the symptoms we saw in this case, which are rather peculiar, isn't it? That there's a kind of arthritic pain shifting from one joint to another, isn't it?
Yes.
Did you find that somewhere?
The central question for the students regards the relationship between the previous flu and the present symptoms. They have the misconception that rheumatic fever has nothing to do with it. To diagnose this misconception, the tutor asks questions about this relationship and the different categories of juvenile arthritis, and stimulates others to share their knowledge about this topic. Through these interventions, he stimulates the discussion and the reasoning process of the students so that they will see inconsistencies in their reasoning, and he tries to direct their thoughts along the right lines.
But aren't we left with the feeling that what we are talking about now, the disease, juvenile arthritis, even the three categories, one way or the other do not fit very well with the case description, isn't it? We have to suppose now that it's not a typical case, and well, that the flu is a kind of distracting element in describing the case. I don't feel very safe about this. How about you?
Not really.
I missed the point, sorry.
That I have the feeling that the disease we are talking about now does not exactly, or maybe even not at all, fit the descriptions of the symptoms that were given to us in the case.
Well,
And it
Well,
says
we-
here too on the first page of that section on juvenile rheumatoid arthritis that mostly in children the different types are very distinct from each other. So it's nothing like it's very improbable that there should be something in between, because you hardly ever see that.
And on the other hand, the symptoms seem not to fit to one of the categories seen in juvenile arthritis.
Well, not exactly, but
but she does have pain in her ankles and wrists, and it began, or the joint complaints began in her knee. So, I mean, she does have complaints in her joints, and
So that's typical, but the flu
Yes.
isn't typical.
well, it is
Well,
with
we-
the systemic type.
Yes.
That's what I'm saying. It might just be a mixture, and
I don't think it's typical because in the systemic type, I thought the fever peaks were high, and
Yes.
the idea I had from this girl is that she just had a fever, not very high fever, which more or less on
If
the
she
same
would have
level
had
all the
high
time.
peaks of fever, I
Yeah,
suppose
that's
she would have seen her physician earlier. She
Yeah.
waited.
yes, but I'm not sure if these high peaks of
The tutor again reflects on the inconsistencies and the ad hoc explanations the students develop about the relationship between the flu and the symptoms. By doing so, he stimulates the students to rethink the topic, guides them in the right direction, and keeps the learning process moving. He also asks questions about the fit between their explanation and the symptoms in the case. In this way, he stimulates the students to apply their knowledge to the case.
Does it fit? It said also in the case that the knee was improving. So it started in the knee, it improved, and now other joints are affected. Does that fit with the polyarthritis?
I don't know.
I don't know. I didn't read anything about the complaints stopping.
Ameliorating now.
Again, the tutor asks questions about the fit between the student's explanation and the symptoms in the case in order to diagnose and direct their learning process.
Janice, maybe the point is here to give a kind of summary of where we are.
That would be difficult. So we're stuck at what the young lady really has, and yeah, it's more or less difficult to explain with what we have done. It's kind of a systemic onset of juvenile rheumatism, and some of the complaints of the symptoms can also be explained by polyarthritis. If I understood, if I understood correctly.
But our hypothesis was that, well, exactly as formulated on the blackboard, can the symptoms of this patient be explained by juvenile rheumatoid arthritis? And maybe we can go along the arguments either in favor or on the contrary to this hypothesis. That's what I was looking for.
I think.
Maybe the others can help you.
Yeah.
During the reasoning process, the group members explain a lot of things to one another, and it becomes somewhat confusing. The tutor tries to support the discussion leader by signaling the need for a summary. Because it's difficult for the discussion leader to summarize, the tutor invites the other group members to help her. By asking for a summary, the tutor encourages the students to get an overview of the subject and to integrate their knowledge.
It must have done some physical diagnosis on her, and we don't have any information on that.
Do you have any information on that?
Sorry, about
Physical
no, no,
examination.
but there, anyway, it isn't specified here, so you may assume that it's that
Negative.
those things
And the lab.
do not exist.
Lab?
Well,
Is
can
this
we?
lab testing be done? Or isn't
Lab test on what?
Ah,
Anything. The whole list.
We forgot about that.
Can you speak a little louder?
Well, the lab testings. I mean, there in rheumatism, there's a rheuma factor. You can, well, you can detect, and if she is suffering from rheumatoid fever, there was a streptococcus infection of the throat, so you can detect that. No?
Yes, you could. So, but
But is it done? I
but
mean,
not. Is that it within the juvenile arthritis? Does that play a role there?
the streptococcus plays a role in the rheumatoid fever.
Mm-hmm.
I don't know if you want to exclude that.
Yes. Well,
Wait.
they did that lab test and it was positive.
Huh?
Oh,
Okay.
Oh.
Well, I skipped the chapter from rheumatoid fever because of the symptoms I mentioned there.
Yeah, because that's what you
But
said
so-
just now. You said
Yeah.
they didn't fit at
Perhaps
all.
I should have read it.
but just
Oh.
But what didn't fit to the symptoms?
Oh, I don't remember. I just skipped it because of the. Oh no.
But you said the lab test was positive
Yes.
on the
On-
rheuma.
No,
factor.
on the streptococcus.
The streptococcus.
Mhm.
Oh, I see.
So that's
Wow.
that explained the throat
It's
ache.
true.
What- what
is
And
it?
I think so.
Migrate.
And the flu, maybe.
The flu, maybe.
So maybe we went into the wrong room. So where we thought
Yeah.
trying to fit the symptoms to the disease and it didn't really work,
Yeah.
that we may have chosen the wrong one.
Yes.
So
Did anybody else study?
No, I only have a short list of differential diagnosis of juvenile rheumatoid arthritis,
Yes.
and it says rheumatic fever, and it says it's a migratory acute arthritis that
And
may be associated with carditis, skin rash, etc., etc., follows a previous streptococcal infection.
Migratory, you say, huh?
Micro
So
what?
Yeah.
that's what the
That
patient
would
has.
fit perfectly.
Yeah.
Micro what?
Migratory. It jumps
Migrate.
Oh
From
yeah,
one-
yeah. Yes.
migrates.
Oh, yeah.
so
So we
what's our conclusion, Janice?
Yeah, we could explain, the symptoms could be explained by rheumatic fever.
Well, we don't know yet,
Yeah.
We don't know.
but
Could be.
it could be. Yes.
Could be.
Hmm.
So,
So that rings the bell for another round, isn't
yes.
it?
it
Yes.
is.
Shall we define another learning objective then, or
Yeah, we should.
can we
We ought to.
well, easily adapt
Yes.
this one, isn't it?
Yes. Good.
The students see the need for more information. The tutor has more information available in his tutor's guide. He doesn't just give the information, but forces the students to be more specific and to relate the quest for information to their explanation. The students then discover the right diagnosis. The tutor has made them aware of a gap in their knowledge and stimulates the group to formulate a new and more specific learning goal. The tasks of the tutor can be summarized as follows: questioning and challenging students' reasoning process, stimulating student-directed learning, responding, creating a climate for learning, supporting the discussion leader and secretary, diagnosing the learning process, keeping the learning process moving, giving feedback and evaluating the process of the tutorial group.